Question 111. In an infant born vaginally, there is an abnormal appearance of the right arm, characterized by it hanging limp by the side and being medially rotated, with the forearm extended and pronated. Which of the following muscle would still be functional? Option A, triceps. Option B, supraspinatus. Option C, biceps. Option D, deltoid. In this infant with the described arm abnormality, the muscle that is still functional is triceps. Explanation: the presentation of the right arm hanging limply by the side, medially rotated, with the forearm extended and pronated suggests a condition known as Erb's palsy or brachial plexus injury, which commonly occurs during difficult vaginal deliveries. Erb's palsy typically involves injury to the upper brachial plexus, affecting the C5 and C6 nerve roots. The triceps muscle is innervated by the C7 nerve root, which is not typically affected in Erb's palsy. Question 112. An elderly male presents with neck swelling, without any symptoms of hyperthyroidism or hypothyroidism, and no signs of obstruction. Laboratory results show high levels of calcitonin. What is the most likely diagnosis among the following options? Option A, lymphoma. Option B, anaplastic medullary thyroid cancer. Option C, papillary thyroid cancer. The correct answer is option B, anaplastic medullary thyroid cancer. Here's an explanation. Elevated calcitonin levels are indicative of medullary thyroid cancer, specifically anaplastic medullary thyroid cancer. Medullary thyroid cancer arises from the parafollicular C cells of the thyroid gland and is known for producing calcitonin. Elevated calcitonin levels are a hallmark of this cancer. Unlike papillary and follicular thyroid cancers, which often present with hyperthyroid or hypothyroid symptoms, anaplastic medullary thyroid cancer may not exhibit these classic symptoms. This makes it distinct from other types of thyroid cancers. Lymphoma is less likely in this context because the elevated calcitonin levels and neck swelling are more suggestive of a thyroid-related issue, especially when thyroid cancer is associated with high calcitonin levels. Question 113. A 40-year-old nulliparous woman has completed her treatment for breast carcinoma and is planning to become pregnant. As her healthcare provider, what is the recommended time frame for her to conceive? Option A, wait for 3 months. Option B, wait for 9 months. Option C, wait for 2 years. Option D, wait for 5 years. The recommended time frame is option C, wait for 2 years. Here's an explanation. After completing breast carcinoma treatment, it is generally advisable for women to wait for a certain period before attempting to conceive. This waiting period allows time for recovery from the treatments and for the healthcare team to monitor the patient's health. Waiting for 2 years before attempting pregnancy is a common recommendation in such cases. This time frame allows for the monitoring of potential cancer recurrence and ensures that the woman's overall health is stable before pregnancy. Question 114. In a new study aiming to examine the impact of HIV on mortality, participants from hospitals were recruited and observed for a period of 10 years to assess mortality rates in both HIV-negative and HIV-positive individuals. What ethical principles should guide this research? Option A, a significant financial gain. Option B, frequent presence on social media. Option C, prioritizing the rights of the study participants. Option D, prioritizing the confirmation of the research hypothesis. Ethical principles in this research should prioritize the rights of the study participants. Explanation: ethical research requires that participants provide informed consent willingly. In a study like this, where individuals are recruited to examine the impact of HIV on mortality, It is crucial to ensure that participants fully understand the nature of the study, potential risks, and benefits, and that their consent is obtained without coercion. Participants' privacy and confidentiality should be safeguarded. Given that this study involves sensitive medical information, it is essential to protect the identity and data of participants. Options A and D do not align with ethical principles, as research should not prioritize financial gain or the confirmation of a hypothesis at the expense of participant rights and well-being. Option B, frequent appearances on social media, is not a primary ethical consideration in research but rather relates to the communication and dissemination of research findings. Question 115. A patient who underwent spleen removal along with other organ procedures received parenteral nutrition via a central line and developed a fever of 39.4 degrees Celsius 12 hours after the previous surgery. Subsequent lab results showed no significant abnormalities. What is the likely diagnosis among the following options? Option A, pneumonia. Option B, central line infection. Option C, acute respiratory distress syndrome. Option D, deep vein thrombosis, DVT. The likely diagnosis for the patient is central line infection. Explanation. The use of a central line for parenteral nutrition provides direct access to the bloodstream, which can increase the risk of infection. The development of a fever after surgery, especially in the presence of a central line, is concerning for an infection related to the central line. The fact that the fever occurred 12 hours after the previous surgery suggests that it may be related to an infection acquired during or after the surgical procedure. The insignificant abnormalities in subsequent lab results do not rule out an infection, as it may take time for certain markers to become abnormal. While other conditions like pneumonia, ARDS, and DVT can cause fever and may also be considered in the clinical evaluation, the most likely diagnosis in this context is a central line infection. Question 116. In the case of a 75-year-old man undergoing a prostate examination, during which a firm solitary nodule is felt in the prostate, and a biopsy reveals small closely packed glands containing cells with prominent nucleoli, what is the diagnosis? Option A, urothelial carcinoma. Option B, adenocarcinoma. Option C, chronic prostatitis. Option D, prostatic hyperplasia. The diagnosis in this case is adenocarcinoma. Explanation. The presence of a firm solitary nodule in the prostate in a 75-year-old man is concerning for prostate cancer, particularly adenocarcinoma, which is the most common type of prostate cancer. The biopsy results that show small closely packed glands containing cells with prominent nucleoli are indicative of adenocarcinoma. This is a characteristic histological pattern of prostate cancer. While chronic prostatitis and prostatic hyperplasia can cause prostate-related symptoms, they typically do not present with a firm nodule, and their histological characteristics differ from those of adenocarcinoma. Urothelial carcinoma is a type of cancer that typically originates in the bladder or upper urinary tract. It is less likely to be associated with a prostate nodule and the described histological findings.